Hello everyone, I'm Dr. Athena Trenton and I'm the Executive Director of NAMI North Texas, the North Texas affiliate of the National Alliance on Mental Illness. We at NAMI North Texas have been providing no-cost mental health support services for over 35 years. Although we are not clinicians, we are the bridge that connects individuals in need with low to no-cost clinical services. While building that bridge, we provide free peer support and family support groups, education classes, and a supportive, non-judgmental community so no one has to navigate their way to recovery alone. The coronavirus pandemic has put all of us in unfamiliar territory, causing stress and anxiety in many different forms for many different reasons. Those already challenged with a mental illness are often told not to self-isolate as it tends to worsen symptoms. So, as we are expected to shelter in place and practice physical distancing, many of our North Texas neighbors are suffering alone. We already know our frontline medical workers are exhausted and traumatized while they witness massive loss of life as they risk their own to keep the rest of us safe and healthy. Our essential workers are also risking their lives every day to make sure we have our basic necessities as we sit at home, waiting until we can safely interact in public again. These essential workers are mostly low-wage employees, many without health insurance. Imagine the psychological toll going to work every day takes on someone risking his or her life not only to pay their bills, but to keep food on your table. And how about those people deemed non-essential, those who have lost their jobs and are not sure how they will feed their families? Economists estimate that the unemployment numbers will exceed those of the Great Recession. A 2011 study by the Centers for Disease Control reported that suicide rate from 1928 to 2007 rose and fell with the economy. The higher the unemployment rate, the higher the number of suicides recorded. Many professionals in the mental health community are already seeing demand for their services skyrocket. It is expected that the need for mental health services will continue to increase well beyond the expiration of shelter-in-place and physical distancing orders. Some are already predicting mental illness as a result of the COVID-19 crisis to be a second pandemic. My staff and I are already preparing for this and expected the demand for our services to greatly increase over the next couple of years. It is therefore critical we recognize now that the mental health of our community is just as important as our physical health. This is why I'm asking you today, on May 5th, North Texas Giving Day Now, to help us raise the funds we need to ensure our no-cost mental health support services continue to be accessible to those with mental health challenges, as well as healthcare providers, essential workers, and the unemployed. They risked their lives and sacrificed to keep us safe and healthy. Now it is our turn to ensure they stay safe and healthy. Be well, and thank you for taking the time to listen to this message. If you would like to donate to NAMI North Texas today, please go to northtexasgivingday.org and search for NAMI North Texas.